भाई हो गया कंप्लीट हो जाएगा। हाँ हाँ ये तो क्लास हो गई पूरी। मैं वो क्या जैसे थैंक यू बोल रही है बच्चे बढ़िया नहीं निकल रहे हैं।
Capsule intact but implant rupture. This was your last year AIMS question. ABCD में से बताओ सर आंसर. Okay. To understand that, you need to understand basically how does it work. We'll talk about breast implant for a second. So take a breast implant. Most of you understand when I talk about the breast implants basically of silicon have two different surfaces. One is the external surface and another is internal surface. The external surface of the breast implant is referred to as the capsule of the breast implant. This is referred to as capsule of the breast implant, and within the capsule you have the original implant itself, which is rich in silicon dense tissue. So it is the silicon implant right in itself here. So the breast implant basically consists of two portions. One is capsule, another one is implant. In your All India question, they've asked you what is this implant made up of. It is purely made up of silicon gel. It is purely made up of silicon gel. That is one question to be remembered. Now what happens is, due to any trauma, there is a possibility that the both capsule as well as the implant will rupture. Agar both capsule, if I say both capsule as well as the implant is ruptured, both capsule as well as the implant is ruptured, the silicon gel that is present inside the implant will actually leak out. अगर दोनों rupture कर गया, that is both the capsule as well as the implant has ruptured, the silicon that has been present here will leak out. When the silicon will leak out into surrounding tissue, it will form a granuloma. When the silicon will leak out into surrounding tissue, it will lead to formation of a granuloma, and the silicon induced granuloma is referred to as silicoma. It is referred to as silicoma. Last year PGI they asked you what is the silicoma. Silicoma is nothing but a complication that is seen after breast implant injury, where both capsule as well as implant are usually ruptured. They can ask you what is the investigational choice for silicoma. You have to just understand that if silicon is involved, that means breast implant is involved in any tissue or any condition where you have breast implant evaluation. Remember, the answer would be investigational choice would be MRI. Any implant related complication, the investigational choice would be MRI. For that simple fact, it becomes what is the investigational choice for silicoma? आपने answer करना है MRI. Investigational choice for silicoma also stands as MRI. There is another possibility where the capsule remains intact. That means the capsule is not been damaged, the capsule remains intact. But what present inside it, that is the implant, gets ruptured. If the implants get ruptured, the silicon gel will be present within the capsule, it will not leak out. Agar silicon gel within the capsule present hai, it will not leak out. If it will not leak out, it will not form silicoma. But you can see the border of the implant will actually be wavered inside. The implant का जो regular border है, that has been ruptured, so the wavery border appearance of an implant within the capsule. So I can say here the capsule is intact. The capsule is intact, but the implant is ruptured. Any condition where you have rupture of implant but capsule is intact, this is referred to as anybody? Radiology में सबने बताया होगा sir. What is the sign referred to as? Linguine sign. So they'll see what is linguine sign. Linguine sign is nothing but it is a breast related complication or an implant related complication where the capsule remains intact but the implant itself gets ruptured, and the wavery border appearance of an implant within a capsule is referred to as linguine sign. आपसे पूछा हुआ what is the investigational choice to demonstrate linguine sign? Again I did not repeat, any implant related complication आपने आंसर करना, it is MRI. So again linguine sign is demonstrated on MRI. Linguine sign is demonstrated on MRI. Another thing to be observed here is whenever the capsule is intact but the implant is ruptured, this becomes a very semi-solid or semi-soft condition, sudden softening of the breast. sudden softening. Usually the implants which are present, they are semi-solid, they produce a firm appearance of the breast. But whenever there is an implant rupture, the gel will leak out. The capsule does not have the integrity to hold the gel. If there is anybody or any question that says sudden softening of breast, sudden softening of breast after an episode of trauma or an infection or any other condition, of course there should be a history of implant. So it's a sudden softening of breast. Sudden softening of a breast after a history of trauma or an infection or anything else, and when you perform an MRI and you see such a representation, that would be Lingwine sign. So this is a complication that you see in a condition of breast implant. Coming back to the question, here you can see the whole capsule remains intact. There is no leakage of silicon. You can see there is a wavery appearance of the I would say implant membranes. The implant membrane is present within the condition, and this is referred to as Lingwine sign. If it is Lingwine sign, this is the MRI image. What would be the answer, sir? Capsule remains intact, but the implant is ruptured. So the question number 1 you need to remember, it's a demonstration of Lingwine sign. Lingwine sign is a representation of ruptured implant, capsule intact. Ruptured implant, but capsule intact. Continuing on the same frame. All India will ask you a question of breast implant पे, so I'll just continue on that only. I just told you about one variety, so I'll be talking about different types of breast implant. I can categorize them as autogenous, breast implant, alloplastic, autogenous breast implant, alloplastic and combined. So I would request you to have a little bit of active participation so that we can run through across it. What is the most common autogenous graft used in breast implant? Most common autogenous graft implant. So it's been a repeat question in DNB All India multiple times. Answer would be TRAM. That is transverse rectus abdominis muscle. That happens to be the most common autogenous graft used for breast implantation. अगर TRAM ऑप्शन में नहीं है, what is the second most common autogenous graft है? आपने आंसर करना latissimus dorsi flap. Next one will be latissimus dorsi flap. So second most commonly used one is latissimus dorsi flap. अगर latissimus dorsi भी नहीं है, the next one would be used commonly would be gluteal flap. See, the one that I'm writing, everything is in order, starting from TRAM to the gluteal flap. TRAM is the most commonly used one. If it is not in the option, the next answer or best answer to be picked is latissimus dorsi. If it is not in the option, gluteal flap. See, there was a question, what is Rubens flap? I'm not saying fourth common, just 3 के लिए याद रखिएगा. These are the top 3 to be used. But there is something was a question arising in DNB. They said Rubens flap. देखिए, Rubens flap is also used for breast reconstruction. It is nothing but a muscle that is supplied by anybody. Rubens flap का blood supply कौन सा है? Anybody? It is deep circumflex iliac artery. Deep circumflex iliac artery. Rubens flap is supplied by deep circumflex iliac artery. So basically the question that was asked is, what is the flap that has been supplied by deep circumflex iliac artery? Answer yaad rakhiye, Rubens flap. Another important point about the Rubens flap, this is also used in the context of breast reconstruction. Another miscellaneous one I can tell you, thoracoepigastric flap. Thoracoepigastric flap. Thoracoepigastric flap. And the last one is lateral thigh flap. And the lateral thigh flap. Out of the 6 that I've written, please do remember the one that I'm going to mark in red. That is the most common one, that is TRAM and the Rubens flap. These were your exam questions. So TRAM happens to be the most common one, followed by Rubens flap का blood supply याद रख लेना, deep circumflex iliac artery. Talking about the alloplastic graft, alloplastic में most commonly कौन सा use होता है sir? So silicon. Most commonly used is silicon gel implant. Silicon gel implant is most commonly used. Latest बता देता हूँ आपको, it is silicon gel with anybody? Silicon gel with refillable saline. Silicon gel with refillable saline is the latest one that we use in the alloplastic ones, which is actually been demonstrated. But then fine, अगर आपसे एक ही पूछना है तो आंसर करेगा silicon gel. Combined में you can use both, that is alloplastic as well as the autogenous graft. The most commonly used combination is latissimus dorsi plus silicon gel implant. Most commonly used is latissimus dorsi plus silicon gel implant. अगर ये ऑप्शन में नहीं है, the next commonly preferred one is tram with silicon gel implant. Tram with silicon gel implant is the next preferred one. It is the next preferred one. So these are the different grafts that you need to know, that is autogenous, alloplastic and combined. If I ask you per se, which is the overall most commonly used graft, not autogenous, not alloplastic, combined, overall most commonly used. अच्छा मुझे बताइए breast implant जो होता है, is it used for therapeutic conditions or cosmetic conditions? Mostly किसके लिए use करते हैं? How many of it is for cosmetic purpose? And how many of it is therapeutic? Remember, breast implants per se are never used for therapeutic conditions. They are never indicated for therapeutic. It is only and only for cosmetic issues. When you're looking for only cosmetic, will you go for an artificial one or a natural one? So cosmetic, artificial and natural. If you take a natural one, that means you're removing one graft from a side and putting it in another. So cosmetically you're making deformity again. Remember, cosmetically use के लिए हमेशा alloplastic use होता है. So most common overall is alloplastic, that would be silicon gel per se. तो अगर आपसे एग्जाम में पूछता है what is the most commonly used overall, that would be silicon gel implant. There was a question long ago, not now. They said what is the treatment of choice for amasia? Treatment of choice for amasia, sir. Treatment of choice for amasia. जल्दी बताओ sir, we'll continue our discussion. I don't want to waste time on small things. Treatment of choice for amasia, बताइए sir. So you understand amasia, right? Absence of breast. What is absent in breast? Nipple present होता है कि absent होता है amasia में? Simple question. Nipple areola in a patient of amasia is present or absent? कितने लोग बोलते हैं present है? और कितने लोग बोलते हैं amasia means total absence of breast including nipple and areola? Nobody. Okay. Just to remember, it is nipple and areola is present. It is only the stroma and the glandular tissue which is absent. My concern is not that. My concern is what is the treatment of choice? क्या करोगे sir? Autogenous करोगे, alloplastic करोगे, क्या करोगे? Autogenous, alloplastic or combined? Treatment of choice for amasia, quick. What would you use? Autogenous, alloplastic या combined? Sir, answer है कुछ भी use नहीं करोगे. I told you it is never used for therapeutic purposes. I have asked you for treatment of choice. यहाँ पे therapeutic purpose पूछा हुआ. So none of them are used. It is reassurance. Counsel करेंगे patient को, reassure करोगे. There is nothing else to be done. हाँ, cosmetically बोलेगा, then you can go for any graft you want. But treatment of choice for amasia without any controversy, it would be just reassurance. So that is all you need to know. अगर आपको breast implant में दो चीजें पता है, एक is silicoma, दूसरा Lingwine sign and the classification which I have given you. That is more than enough. Do not waste your time reading other things. चलिए, moving on. Taking up the next question. Question number 2. This is the image right here. Forget about the question. You look at a mammograph. Forget about the question, just look at the mammograph. What are the similarities that you see? I've given you both right and left breast. दोनों में lesions present है कि absent है? So just follow my lead. Do not look at the question papers. We'll revise all the topics. I just need your attention. आप मुझे बताओ, when you look at both left and right breast, do you see a unilateral lesion or both the breast having lesions? Both the breast having lesions. Are they calcified lesions or are they soft lesions? Because they are calcified, you can see in high density tissues, both bilateral. Whenever you think about two things, calcified lesion, bilateral presentation, what is the first thing that strikes your brain? Calcified lesion, bilateral presentation, it's a benign condition. I repeat again, calcified lesion, bilateral. If calcified unilateral, it can indicate malignancy. But if it is calcified bilateral, it is always, most of the time it is a benign condition. Followed by that, you can see a peculiar shape of the calcification. Is it micro or macro calcification? What is the size differentiation? How do you know it is micro? How do you know it is macro? Those who have attended my class recently, I've taken in Hyderabad only, I've told you the size demarcation for what is the micro calcification and a macro on a mammogram. It is 0.5 millimeters. Anything more than 0.5 millimeters, it is considered to be a macro calcification. Less than 0.5, it is micro calcification. Abhi aapko jo dikh raha है, it is macro calcification. Remember, macro calcification always indicates towards benign nature. Micro calcification will indicate towards malignancy. So first catch point, I can see bilateral. I'm thinking about benign condition. I'm thinking about calcification, again benign. I'm thinking about macro calcification, again benign. So I'm mostly sure it's a benign condition. Then you see there is actually a peculiar shape of it. How does it appear to be? Popcorn calcification. So आपको question पढ़ने की जरूरत नहीं है. When you look at the image, if you are able to make a picture out of it, it's a popcorn calcification. Popcorn calcification कहाँ देखते हैं? Fibroadenoma. Now it says 24 years old female. When you see the age, young female, again benign condition. Then you see on physical examination the breast mass is hypermobile. When it is see, mobility is something that is usually associated with benign condition. Fixity is the condition associated with malignancy. Young female, bilateral presentation, mobile mass. Because it is hypermobile, it is alternately referred to as fibroadenoma is alternately referred to as breast mouse. Because it is hypermobile, it is alternately referred to as breast mouse. On a mammograph, you have the visible lesions. What is the most possible diagnosis? Answer is spot on. It is fibroadenoma. So let's revise fibroadenoma. What are the things that you need to remember in the context of fibroadenoma? I hope everybody followed my lead. Whenever you look at a question of a mammograph, you have to ask yourself, question number one, is it a benign or a malignant condition? How do you know it's a benign or malignant? Number one, look for bilateral like unilateral. अगर उसने एक ही breast दिया, we cannot do anything. Then you cannot compare. Then you see, is it macro calcification or micro calcification? If it is macro, then you look for mobility and age of presentation. Young female, bilateral, mobile, benign. Elderly female, unilateral microcalcification, malignant. Just keep this statement in mind, you'll be okay with it. Chaliye, let's do a quick review of fibroadenoma. Fibroadenoma happens to be the most common benign tumor of the breast, number one. Fibroadenoma happens to be the most common benign tumor of the breast. What is the overall most common benign tumor of the body? Overall most common benign tumor of the body. It is universal tumor, also referred to as lipoma. If they say what is the overall most common benign tumor of the body, that is lipoma. It is also alternately referred to as universal tumor. Also referred to as universal tumor. I would like to ask you a question. What is the most common malignancy that you see in females worldwide? Let's make it very quick. Females worldwide, most common malignancy. It's a simple question. Females worldwide, most common malignancy. Answer. Sir, doubt nahi karna. Answer is breast carcinoma. अब आती है controversy for males. I say males worldwide, most common malignancy. बोलिए सर, किसने बताया सर आपको लंग? Who told you it is lung? If somebody has stated saying that males worldwide is lung carcinoma, please do ask for references. अगर आप अपना booklet देखोगे, page number 2, I've given you references of both Harrison's as well as your Robbins with the percentages itself. Remember, worldwide male के लिए answer करोगे prostate. I'll also tell you when to answer lungs. When they say what is the most common malignancy, males worldwide causing mortality. If I say what is the most common malignancy worldwide in males causing mortality, then the answer should be given here as lung carcinoma. Otherwise the answer remains as prostate. If I change the question to females worldwide mortality, answer क्या करोगे sir? Females worldwide mortality. Answer अभी भी lung cancer ही रहेगा. Lung cancer is provided with higher rate of mortality than rest of the other malignancies, which I've already represented on the table that I've given to you. Most common pediatric population में बता दो sir. Most common pediatric population worldwide. I'm not asking mortality just by incidence. So leukemia na sir, ALL. Most common pediatric population overall worldwide is ALL. Okay, not my topic. Talking about fibroadenoma, it is the most common benign tumor. Remember, it is usually bilateral. It is usually bilateral. It is encapsulated. Because it is encapsulated, it does not adhere to the surrounding tissues. Because it does not adhere to surrounding tissues, it is hypermobile. Because it is hypermobile, it is alternately referred to as breast mouse. Alternately referred to as breast mouse. What is the usual presentation of a fibroadenoma? Remember, it is usually a painless presentation. It is painless, hypermobile lump or breast mass in the condition. What is the investigation of suspected case of fibroadenoma? आपके पास 24 years old female है presenting with a breast lump, both bilaterally presenting. What is the investigational choice that you would like to perform? You have to consider two things. One is female is young.